So I work as a receptionist most of the time. I mean, part time, less of the time I'm doing computer work and stuff like that for my boss. But most of the time, because everyone calls out sick to work at the government because they give so much time off, they don't pay overtime. That I'm covering all the clinics, so I'm doing reception work. So this is the work life of a receptionist. This is what you're gonna. If you want to be a receptionist, I don't want anyone who wants to be a receptionist, but if you are a receptionist and you're about to be a receptionist, you have no other choice in life to be a receptionist. This is what to expect. Everyone is angry and wants to fight you. Everyone who comes in, wherever you work. I mean, I work with veterans, so I guess they're even angrier. Veterans usually have PTSD and they're angrier and crazier. But everyone who comes in is angry and wants to fight you. Just expect that. It's like working at the DMV. They just think that you're trying to stop them from doing whatever they're trying to do. Like your job is to just prevent them from doing whatever they want to do, so they come in to fight you. Everyone lies. So either if you're going to usually be dealing with patients, probably you're working in a hospital setting or some type of setting where you're dealing with we're dealing with patients. Patients lie, people lie in general, but patients will lie their ass off to get an appointment. Especially if you're dealing with drugs, if you're in a clinic with drugs. I have people telling me, because I deal in an opiate clinic, drug addicts will tell me they dropped their drugs in the toilet bowl, and that's the whole story. That's the end. It's not even like I accidentally, like, oops, and then I tripped and I flushed the toilet bowl and I accident on top of it. They just say that they dropped their opiates, their oxycodone, in the toilet bowl. And first of all, a drug addict is going to bob his head in to get drugs out of the toilet bowl. He will use his teeth. If he has no arms, he will use his teeth to get drugs out of the toilet bowl. So I already know that's bullshit. But also that, did you flush it? Like, how could you? And then they say that or the drugs got stolen out of their truck. You know, they were in the back of my truck and they got robbed because you got psychic. Other drug addicts are psychic, and they know which trucks have drugs in them, and they go in and steal them. So people lie endlessly, and you need to just be prepared that just take everything as a lie. Take everything as a lie that someone says until you can get evidence to back it. All right. So patients will schedule 2 appointments near the same time and blame the hospital for it. Really, this is a video more about being a receptionist in the hospital. Patients will schedule 2 appointments at the same time and blame the hospital for it. We have patients who you have to hold their hand like a child. And when you schedule appointments for them, you have to be their secretary. You have to be every single patient's secretary. You need to know exactly every single patient's schedule because they don't know their own schedule. It's like a mystery to me how this happens. I know when I have a dentist appointment. I know when I have an appointment. And if I schedule 2 things on the same day, I know that. I know that I'm doing that. I probably did it on purpose so I get them knocked off in a day. But yeah, so they'll blame you. They'll say, "Why did you do? Why did you schedule me?" I'm like, dude, I have to get the okay from you. You have to confirm it. And a lot of the times I just say, like, you also have a 2 o'clock. You want this 2:30? You also have a 2 o'clock. And then they say yes, and I'm like, are you sure? I have to do like the whole game show. Like, are you sure you want the 2 o'clock? Because you have a 2. Like, you have to be so fucking. Because they'll come back and bite you in the ass. Next thing, everyone comes in an hour early. I'm not an hour late or like 4 hours early. Patients will come in at like 11 a.m. for a 3 p.m. appointment and just expect to be seen. If you ever worked, and I don't even mean work as a receptionist, if you ever worked in a job, any job, you pretty much know that lunchtime is 12 o'clock. So if you've worked in your entire life, any time in your life, you know that lunchtime is 12. If you're coming in at 11 o'clock and you expect to be seen, don't expect to be seen because you're not going to be seen. You may get seen if the 11 doesn't show up or the 11:30 doesn't show up, but Jesus Christ, the patients will come in at 11 when they have a 3 p.m. appointment, and it's all of them. It's just like 20 guys show up, just fucking right there, and they're all like demanding to be seen right now. Yeah, talking on the phone. No one speaks clearly on the phone. Nobody. No one speaks clearly. Even this probably is a universal thing, not just patients, but just people in general, probably everywhere. But I got people. I'm like, "What's your last name? What's your last 4?" That's how we categorize everyone. So, what's your last name? Okay, so my last name is Yashin Paki, and I'm like, fuck, dude. And okay, what's your last four? 64327. I'm like, I'm like, and you got to be super nice, especially with vets. You have to be ultra nice because there's a patient rep that they'll go to complain to. So I can't even help them because I have to be ultra nice. So I can't even tell them, like, listen, you need to speak clearly. I have to be like, can you just say it one more time? Can you just like, and it's the same thing. It's the same gargle that comes out. And if you tell them, like, I need you to speak slowly and coherently, they just get angry at you. It's 75654. And I'm like, dude, just, I got it. And then they'll end up hanging up on you. They'll hang up on you. So expect that, too. Everyone will treat you like shit, except the housekeepers. Because you and the housekeepers are kind of in the same, like, camaraderie. Because there's pretty much like a noble class of, like, doctors, like nurses, doctors, people with high above a master's degree. That is like the upper nobles. No one talks about it, but you could tell between the tone of voice everyone uses to each other and the way people respect each other and other jobs that you could totally tell there's a hierarchy at work. Probably every work is a hierarchy, but expect that the doctors, the nobles, they get treated pretty well. I mean, patients will yell at them, but other staff members will treat them well, and they'll be talking to me like, yeah, all right, you got to do this, then you got to fucking send this to me, and then when the doctor comes, like, oh, hey, what's going on, Doctor So and So? I just wanted to know if you got that email from me, and so expect like just to be treated like a lesser person, except for the housekeepers. You can pretty much be friends with them because they're with you. But the patients are really treated like shit too. Your opinions are meaningless. Your opinions are meaningless. So your resume is pretty bad. If you have to be, like, my resume is bad. I have a bachelor's, but nothing compared to doctors and stuff. So no one's gonna listen to me. So my opinions mean nothing when I talk. When I have any advice or like some type of change I want to make to the clinic that I think it might be better, meaningless. Doesn't matter. No one's gonna listen to you because your resume sucks. Um, you're blamed for everything, like the pizza delivery guy. You're the face of the patient's appointment time. You're the pizza delivery guy is the face of what time you're getting your delivery. Like if you ordered a pizza at 2 and you got it at 3 and it's late, everyone blames the pizza. I was a pizza delivery guy, so I know this too. They would blame the pizza delivery guy. Meanwhile, this shit could have been sitting on top of the oven for an hour. It could have been backed up. The people cooking in the front may not have made it. They may have made it late. That doesn't matter. You'll be blamed. Just like the pizza delivery guy, you're going to be blamed for everyone's. If they're late, if the doctors in the back are moving slow, your fault. Your fault. It's always your fault. Everything is your fault. Just expect that too. You may get food. Yeah, patients may give you food. This is the good thing. They may give you food. If you're a guy, they won't give you food. That's the only bad thing. The female receptionists get food. The guys get like nothing. They don't even get a goodbye. The patient will be like, and thank you, Miss D, for doing everything for me. And that son of a bitch over there, he sucks, but you're great. Here, take this cupcake, take these chocolates. Okay, bye. And then I'll be like, have a good day. And the guy just like, and he just walks out. He doesn't give a shit about you. But the good thing is that maybe you could get the food if you ask nicely to your female receptionist coworkers. They may give you like half a cupcake. This is like a humbling one. You learn how it feels to be small. I think it's very humbling. Being treated like shit and being the smallest person in the hierarchy sucks. But if you ever do move up in life with anything, you'll respect those people much more because you were one of them. So it is a humbling thing to learn what it's like to be small, be a small fish. So that's a good thing.